What do you need to know if you've been diagnosed with breast cancer? And because I can't have an individual one-on-one conversation with you if you're watching this video and you've been diagnosed with breast cancer, I wanted to share with you the questions that I make sure my patients know the answers to before they leave my office from a breast cancer consult. These questions are available in the description below, as well as a downloadable PDF form that you can print off and take to your doctor's appointment with you, which is available at my website, drbethdupree.com. And the reason these questions came up, I was doing a follow-up interview for the docu-series The Answers to Cancer. It was a docu-series done by Jeff Hayes, which I'm going to talk about in another video coming up. And during the follow-up video, I was asked by Patrick, the interviewer, about what things do people really need to ask their doctors about. And I love the fact that a lot of my patients actually come to my office and they have them printed out off the website. So I thought you might want a copy of that as well. So if you've just been diagnosed with breast cancer, first of all, take a deep breath. It's information finding time. Breast cancer tends to be a psychological emergency, not a surgical emergency. There are very few breast cancers that need to have urgent treatment, and those are ones that your doctor will talk to you about how we typically treat those cancers, and that's something for a very specific conversation that you should be having with your doctor. And the first thing you have to know is when you're diagnosed, what type of breast cancer do you have? And we have invasive ductals, invasive lobulars, colloid, mucinous. And one of the cancers that tends to be the scariest one is the term or the type of cancer called inflammatory breast cancer. And that means that the breast has changed very, very quickly. And typically with locally advanced cancers or inflammatory cancers, those are cancers which we will treat first with chemotherapy, but you need to have a diagnosis and you need to meet with your doctor to talk about it. We then talk about how aggressive tumors are, and the aggressiveness of the tumor is really the grade of the tumor. How fast does it look like it divides under the microscope? The next question you're going to ask, or the next thing you should find out, is what are the estrogen, progesterone, and HER2 receptor status of your tumor? Because these are things that help us to personalize the care of your breast cancer, the actual treatment of the breast cancer. Everybody wants to know what clinical stage the cancer is. And the clinical stage and pathologic stage are two separate things. Clinical stage is the stage of the cancer, the size of the tumor, whether the lymph nodes appear involved, or whether we think it's elsewhere in the body. And that's based at the time of the initial diagnosis. The pathologic stage is the stage that we know definitively after surgery, whether the lymph nodes are involved or not, and the actual size of the tumor. The other thing that's important to know is, do you need additional imaging? Sometimes after a cancer diagnosis, you don't need additional imaging. Sometimes we need to get MRIs. Sometimes we need to get additional ultrasounds. Other times, PET scans, PET CT scans, bone scans, CAT scans. Each of those are determined based on the clinical stage and type of tumor that you have, and that's something that you need to ask your doctor specifically. The other thing are, what are your surgical treatment options? Sometimes cancers are in more than one area in the breast, so not everybody's a candidate for breast-conserving surgery. The other things that we look at as doctors that are very important are the tumor's biology, or the genomic profile of the tumor. So the genomic profile of a tumor is what your tumor's DNA is saying and telling us, as opposed to your DNA. So your genomic profile could be done with a test called a MammaPrint, an EndoPredict, an Oncotype, and these are tests that your doctor will run to help us determine whether or not chemotherapy can benefit you. Sometimes whether chemotherapy isn't needed, even if your lymph nodes are positive. And not everybody gets this test, but it's important to ask your doctor why or why not you're not getting one of those. The other thing you need to know about is, what are your options? Whether you can have a lumpectomy, whether you can have a nipple-sparing mastectomy. What type of lymph node biopsy? Are you a candidate for a sentinel node biopsy? In addition, talking about the risks of the surgeries. What's the risk of getting swelling in your arm long-term called lymphedema? Does your doctor do anything to monitor for that? Do they do a bioimpedance test, or do they measure your arm with a tape measure to determine whether or not you're getting swelling in your arm. The other thing is whether or not you need chemotherapy. And a lot of times we don't know that at the very beginning. Some tumors, like triple negative breast cancers and HER2 positive breast cancers, your doctor may be able to tell you right away, you're going to need to get chemotherapy regardless. And so what we're trying to do at initial diagnosis is get you the answers to these questions so that you can make the very, very, very best decisions for yourself. Additionally, some women are old enough and they can safely avoid radiation therapy. Most breast cancers that are treated with breast conserving surgery require some form of radiation therapy locally to the breast. The other thing that you may be a candidate for is a shortened course of radiation called partial breast radiation therapy. And that is a 5-day course of radiation therapy. And again, it's a question to ask your doctor, how many days of radiation will you need and what are the possible side effects of the radiation therapy? Additionally, most women that are diagnosed with estrogen receptor positive breast cancers will be given some form of anti-estrogen therapy and very specific things that they can do in their lifestyle to decrease their risk of getting breast cancer again. And that's the subject of the previous YouTube video I just did, which we talked about lifestyle modification, which every woman can benefit from that just to help prevent the risk of getting breast cancer. Most women also want to know about genetic testing. And in 2017, the American Society of Breast Surgeons recommended that almost all women should get genetic testing because we know that there are a lot of genes that are passed from man to man and then potentially to woman and may never express themselves as breast cancer. So I think understanding what your genetic risk is very important as well. The other thing that I do for my patients that not every doctor does is I help to incorporate integrative healing modalities into the cancer treatment. And this isn't to replace chemo or surgery or radiation. These are things that we do to enhance the immune system, to enhance mind-body medicine, where we're helping to alleviate the stress that comes from a cancer diagnosis. So ask your doctor, number one, if they offer those things within their practice, and number two, if they don't offer them, are they okay with you receiving them? And work with them and ask them if they will work with you to come up with the best plan that you possibly can have. And then the final thing should be, what is my current possible treatment options? What is exactly specific for you? What does your doctor recommend? And ask them, has my case or is my cancer diagnosis going to be presented at a multidisciplinary tumor board? At my hospital, Northern Arizona Healthcare, and my East Coast Hospital, Holy Redeemer Health System, both are accredited by the NAPBC, which is an organization that helps to standardize the care to make sure that women and men diagnosed with breast cancer are being able to be given all of their options and that their cancer treatment is discussed prospectively, meaning prior to treatment, with a multidisciplinary group with plastic surgery, radiation oncology, medical oncology, and surgery, as well as lymphedema, genetics. We want to make sure that you're getting the very best possible care, so make sure that your doctors are staying on the cutting edge of Western medicine. And the final suggestion is ask your doctor, should I get a second opinion, or are you okay with me getting a second opinion? If the doctor that you're with is not okay with you getting a second opinion, that's usually the first sign that you probably should get one. If someone's not confident enough in their ability to help you through your cancer journey and they don't want you to get a second opinion, you have to ask why and wonder why. So my suggestion is go to drbethdupree.com, download the questions, print them out, take them to the office, and my favorite online resource for breast cancer questions, and full disclosure, I am on the advisory board, is breastcancer.org, because it's concise, clear information. You can put in your pathology diagnosis and get a lot of really good answers and a lot of great resources on your cancer journey. So take care, have a great day, and I'll talk to you soon.